Imagine feeling a sudden severe pain in your chest. Could you recognize this as a sign of a heart attack? A chill runs down your spine as you wonder, could this be it? It's a terrifying scenario, but one that's all too common. Every 40 seconds, someone in the US has a heart attack. Yet, many of us are woefully unprepared for this life-threatening event. We've all heard of chest pain as a sign, but did you know there are 7 other symptoms that could signal a heart attack? They could be as subtle as a feeling of discomfort in other areas of your body, or as apparent as breaking out in a cold sweat. Understanding these signs is crucial because early intervention can make a significant difference in survival rates. So let's dive right in. By knowing the 8 signs of a heart attack, you could potentially save a life. The first and most common sign of a heart attack is chest discomfort. But what does that actually mean? Well, let's dive into it. When we talk about chest discomfort, it can take on many forms. It's not always the dramatic, clutch your chest type of pain we often see depicted in movies. In fact, it's more of an uncomfortable sensation that something's not quite right. Many people describe it as a feeling of fullness, tightness, or pressure in the chest, almost as if an elephant is sitting on their chest. This discomfort typically occurs in the center or left side of the chest. It can be constant or intermittent, lasting for a few minutes, disappearing, and then coming back. It's worth noting that the discomfort can sometimes be mild, which leads some people to dismiss it as heartburn or the result of overeating. However, we need to pay attention to these signs as they might be signaling something much more serious. So, how do you differentiate between heartburn and a heart attack? Here's a simple rule. If the discomfort comes on suddenly, or if it doesn't go away even after taking antacids, it's time to take it seriously. Moreover, the chest discomfort associated with a heart attack often radiates. That means it can spread to other parts of your body, like your arms, back, neck, jaw, or stomach. If you're experiencing this kind of discomfort along with other symptoms like shortness of breath, cold sweat, nausea, or lightheadedness, it's crucial to seek medical attention immediately. Now, it's important to remember that everyone experiences heart attacks differently. Some people might have a sudden and intense pain, while others might feel only mild discomfort. The key is to listen to your body and not ignore the signs it's giving you. And one last thing before we wrap up this scene. If you're in doubt, check it out. Don't hesitate to seek help if you think something's not right. It's always better to be safe than sorry. Remember, chest discomfort is the most common sign, but it's not the only one. The second sign might surprise you. It's shortness of breath. When we think about heart attacks, our minds often jump to the classic image of someone clutching their chest in pain. However, shortness of breath can be an equally important sign to watch out for. This can present itself in many ways, from feeling like you've just run a marathon when you've merely walked up a flight of stairs, to struggling for breath even when you're at rest. In the context of a heart attack, shortness of breath is often caused by the heart struggling to pump enough blood to meet the body's needs. The lungs, not receiving enough oxygen-rich blood, make you feel like you're gasping for air. This can happen with or without accompanying chest discomfort. Now, it's crucial to understand that not all breathlessness is a sign of a heart attack. After all, if you've just finished a strenuous workout, it's perfectly normal to feel winded. But if you're experiencing shortness of breath that's out of proportion to your activity level, or if it's a new symptom that you've never had before, it's definitely something you should take seriously. So how can you tell the difference between normal breathlessness and something potentially more serious? One indicator can be the sudden onset of the symptoms. If you're suddenly struggling for breath without a clear reason, it's a definite red flag. Additionally, if this breathlessness is accompanied by other symptoms such as chest discomfort, nausea, sweating, or lightheadedness, it's vital to seek medical attention immediately. Remember, every minute counts when it comes to heart attacks. The sooner you recognize the signs and get help, the better your chances of survival and recovery. Heart attacks can be frightening, but the more we understand about them, the better prepared we are to respond. Knowledge is power, and in this case, it could very well be the power to save a life. Shortness of breath can be a critical sign of an impending heart attack. So, let's not dismiss it. Let's be aware, let's be prepared, and let's take care of our hearts. Besides chest discomfort and shortness of breath, discomfort in other areas of the body and excessive sweating can also signal a heart attack. Now let's dive deeper into these symptoms. Discomfort in other parts of the body is often a telltale sign of a heart attack that's overlooked. This discomfort can vary widely from person to person, but it's typically described as a feeling of pressure, pain, or a general uncomfortable sensation. It can present itself in areas you might not immediately associate with your heart, like your arms, back, neck, jaw, or even your stomach. For instance, you might feel a sudden, unexplained pain in your arm that doesn't go away with rest or changes in position. Or you might experience a nagging ache in your back that's unlike any regular back pain you've had before. These discomforts can be subtle or severe, constant or intermittent. Regardless, it's crucial to take them seriously, as they could be your body's way of signaling a heart attack. But discomfort in other areas isn't the only sign to watch out for. Excessive sweating, also known as diaphoresis, is another common symptom of a heart attack. Now, it's important to understand that this isn't your typical "I've just had a good workout" type of sweat. This sweating can occur without any exertion and even in cool conditions. It can feel more like a cold, clammy, and intense sweat that's often described as breaking out in a cold sweat. Excessive sweating can happen at any time, even when you're at rest. It can be particularly alarming when it's combined with other symptoms like chest discomfort or pain in other parts of the body. The key here is to note the sudden and unexplained nature of this sweating and not to dismiss it as a simple case of nerves or anxiety. Recognizing these signs can help you respond quickly in a heart attack situation. The sooner you can identify these symptoms and seek medical help, the better your chances of survival and recovery. So, remember, discomfort in other areas of the body and excessive sweating are not symptoms to ignore. They could be your body's way of telling you that something's seriously wrong. Feeling nauseous or lightheaded, these could also be signs of a heart attack. It's not always about the dramatic chest pain we see in movies. When it comes to heart attacks, nausea is a common but often overlooked symptom. It's a sensation of unease and discomfort in the upper stomach, often accompanied by an involuntary urge to vomit. But how does this relate to heart attacks, you might ask? Well, during a heart attack, the blood supply to your heart is blocked, causing part of your heart muscle to be deprived of oxygen. This can lead to a series of chemical reactions that stimulate the brain's vomiting center and cause you to feel nauseous. In addition to nausea, lightheadedness is another sign that should not be taken lightly. It's that dizzy, faint feeling you get when you stand up too quickly. In the context of a heart attack, lightheadedness can occur due to a decrease in blood flow to the brain. When your heart isn't pumping blood effectively, your brain might not receive enough oxygen, resulting in a feeling of lightheadedness or even loss of consciousness. Both nausea and lightheadedness are your body's way of signaling that something isn't right. They might not seem as alarming as chest pain, but they're just as significant. These symptoms can present alone or along with other signs of a heart attack, such as chest discomfort or shortness of breath. They could be subtle, they could be intense, but they should never be ignored. Remember, not every heart attack is the same. Some are sudden and intense, but most start slowly with mild pain or discomfort. Paying attention to your body and recognizing these signs can make a monumental difference. It could mean the difference between life and death, between a full recovery and long-term damage. So if you or someone you know is experiencing persistent nausea or lightheadedness, especially if these symptoms are accompanied by other heart attack signs, seek medical help immediately. It's always better to be safe than sorry. Don't dismiss nausea and lightheadedness. They might be telling you something serious. The last two signs of a heart attack are fatigue and anxiety. Now, we're not talking about the everyday tiredness you might feel after a long day at work, or the anxiety that can come with juggling a busy schedule. This kind of fatigue and anxiety is different. It's more profound and persistent, often occurring without any apparent reason. Imagine you've had a good night's sleep, but you wake up still feeling exhausted, as if you hadn't rested at all. That's the kind of fatigue we're talking about. It's unrelenting, it's debilitating, and it's not alleviated by rest. It's a kind of tiredness that is out of proportion to the activity you've undertaken. This fatigue can be due to the heart not pumping enough blood to meet the body's needs, causing you to feel tired and drained. On the other hand, anxiety that could signal a heart attack is often described as a sense of impending doom. It's an intense worry or fear that's hard to shake off, even when there's no clear reason for it. It's not the typical anxiety you might feel before a big presentation or an important meeting. It's an overwhelming feeling of unease that can't be easily explained. This anxiety can be your body's response to pain, shortness of breath, or other heart attack symptoms. It's worth noting that these two signs, fatigue and anxiety, can be subtle. They may not be as noticeable as chest pain or shortness of breath, but they are just as important. They can be early warning signs, giving you precious time to seek help before a heart attack occurs. These symptoms may also be more common in women than in men. So, ladies, pay special attention if you're feeling unusually tired or anxious. It could be your body's way of telling you something's not right. Remember, every second counts when dealing with a heart attack. If you or someone you know is experiencing these symptoms, don't hesitate to seek medical help immediately. Fatigue and anxiety can be subtle signs of a heart attack. Don't ignore them. Now that you know the signs, let's talk about prevention. Preventing a heart attack isn't a one-time event, it's a lifestyle. It's about making choices every day that keep your heart healthy. And these choices aren't as hard as you might think. Firstly, let's talk about lifestyle changes. If you're a smoker, quitting is the best thing you can do for your heart. Smoking damages your blood vessels, making them more susceptible to blockages. And we all know what that means, a higher risk of heart attack. Also, limiting alcohol and managing stress levels can go a long way in protecting your heart. Next, let's discuss healthy eating. A diet rich in fruits, vegetables, whole grains, and lean protein can help reduce your risk of heart disease. Foods high in saturated and trans fats, cholesterol, and sodium can increase your risk of a heart attack by clogging your arteries. So go ahead and swap out that bag of chips for a handful of nuts or that soda for a glass of water. Exercise is another key component. Regular physical activity strengthens your heart and improves circulation. It also helps you maintain a healthy weight, which is crucial because obesity can strain your heart. Aim for at least 30 minutes of moderate intensity exercise, like brisk walking, 5 days a week. Finally, regular checkups are essential. By keeping tabs on your blood pressure, cholesterol, and blood sugar levels, you can catch any potential issues early and take action. Your doctor can provide personalized advice based on your specific risk factors. In essence, prevention is about making conscious decisions for your health. It's about choosing whole foods over processed ones, a morning jog over a snooze button, a smoke-free life over a cigarette. Remember, the best cure is prevention. So let's make choices today that our hearts will thank us for tomorrow. As we wrap up, it's important to remember the 8 signs of a heart attack. This knowledge could be the difference between life and death, not just for you, but also for those around you. Let's take a moment to revisit these signs. The first one is chest discomfort. It's a feeling of tightness or pressure in the center of your chest that lasts for more than a few minutes. The second sign is shortness of breath, which might occur with or without chest discomfort. Next, we have discomfort in other areas of the body and excessive sweating. You may feel pain in one or both arms, the back, neck, jaw, or stomach. And while sweating is normal, excessive perspiration when you're not exerting yourself could be a cause for concern. The fifth and sixth signs are nausea and lightheadedness. You may feel sick to your stomach or dizzy, experiences that are not typical for you. Lastly, we have fatigue and anxiety. Unusual tiredness, particularly in women, and an unexplained feeling of dread or doom can be indicators of an impending heart attack. Now, knowing these signs is only half the battle. It's equally important to understand how to protect ourselves. A heart-healthy diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, can go a long way in keeping our hearts robust. Regular exercise, adequate sleep, and stress management are also key. Furthermore, regular checkups and discussions with your healthcare provider can help monitor your heart health and manage any potential risk factors. In conclusion, it's essential to be aware of these 8 signs and take the necessary preventive measures. Remember, early detection and intervention can drastically improve the outcome of a heart attack. So let's make a commitment to ourselves and our loved ones. Let's promise to stay vigilant, to stay healthy, and to stay informed. Because recognizing these signs could save a life. Stay vigilant, stay healthy, and remember, recognizing these signs could save a life.